So this is a talk we're presenting at the Multinational Association of Supportive Care in Cancer Conference, and this year it's in Adelaide, Australia from the 23rd of June. It's a section of work we've performed at the Primrose Oncology Centre in Bedford, which is one of Cambridge University hospitals in association with Coventry University. The talk's entitled The Bedford Real World Study, and in essence we're trying to find out what level of side effects patients are suffering after cancer treatments. And from that is trying to work out what self-help strategies they're doing, particularly whether they take over-the-counter nutritional supplements or not. A precise knowledge of the level and type of side effects patients are suffering after cancer treatments is really important for a number of reasons, and it's important to get it accurate. When you're counselling patients about the benefits of adjuvant treatments, we really need to explain, what's in it for them, what are they likely to be experiencing for that small level of additional benefits for treatment. It's also important to be able to educate the GPs, the local practitioners, in the follow-up period. If patients, for example, have a high level of arthritis, it's important to explain that to GPs so they know what to expect. Not just so they can counsel the patient, but actually they could initiate self-help strategies such as avoiding putting on too much weight or joining exercise and stretching classes, which might have a preventative measure. The problem is with available data, most of it comes from large randomized controlled trials, which do tend to have a slightly biased or different population to a real world population. For example, patients tend to be younger, they are ethnically less diverse, they don't tend to have so many comorbidities, and they're not in any other trials or have previous malignancies. So the difference between this study and existing randomized studies is looking at an entire real-world population, and because we're doing that, we feel it's a more accurate way of recording precise toxicities in this group. The other end point to this study is to find out what patients are doing to help themselves. We know from existing published data that up to 65%, for example, buy over-the-counter nutritional supplements, which may or may not be a good thing. But what we don't know from existing data is why they take them, what type of supplements they take, and whether the type of medical treatment they're on or what symptom they're suffering from will influence their choice and level of over-the-counter supplement intake. What we actually did in the methodology of this study, which was in partnership with the Bedford Hospital Service Evaluation Department or Audit Department, is that we looked at every single patient over a 6-month period who were attending the oncology unit for their routine consultation. So this wasn't a selected group, this was every patient, and they were approached as part of their routine consultation. The data was recorded from one of 5 existing oncologists within the unit, or 2 specialist nurses, and it was conducted over a 6-month period. A specific questionnaire was designed with the Clinical Trials Development Committee, which asked patients to rank their most troublesome side effect after their cancer treatment. And I have to add that the cancer treatment would have had to have stopped at least 6 months before, so we're mainly interested in the ongoing side effects. So they ranked the most troublesome symptom and the next most troublesome symptom, as many as they wanted. We then asked them if they take over-the-counter nutritional supplements generally, or whether they took them specifically to try and help one of the symptoms they recorded. Once all the questionnaires were collated, they were then sent off to a statistician who's linked with Coventry University for the final analysis. The results showed that 47% of this group of patients with breast and prostate cancer reported at least one or more troublesome side effect. In fact, nearly 50% reported two or more. But the most staggering finding was that if you were on ongoing hormone therapies, you had a 70% likelihood of reporting a troublesome side effect, as opposed to only a 22% likelihood of a troublesome side effect, which was highly statistically significant. So hormones add a significant burden to toxicities in the long term. When we ranked the level of side effects, we were actually quite surprised by the findings. Although hot flushes were very common in both men and women, over 60%, and likewise fatigue in nearly 50%, what was quite apparent was that the level of arthralgia was much higher than previously expected. In women, this was over 55% of women said they were suffering from joint pains or arthritis, and nearly 40% in men. If we look at the established data of the level of toxicities on hormone therapies, for example, these slides show the data from the official prescribing information for anastrozole, tamoxifen and LHRH, you can see that arthralgia was expected in only 15% of people, whereas in our study we noticed it was over 50%. And in fact, looking at the LHRH data set, they hardly mentioned arthralgia at all, and yet in our study we found that up to 40% of men experienced arthralgia. So this is a good example when we actually ask patients what they're complaining of. You sometimes get a different picture. And certainly in my experience as an oncologist, seeing patients on a day-to-day, arthralgia does come into the conversation more and more. And it's not just hormones causing arthralgia or joint pains. Many of the more modern treatments we use these days contribute to the problem. We know that Taxotere chemotherapy causes lots of aches and pains in men. Ongoing Herceptin, patients may be taking this for early metastatic disease and be on it for several years, and certainly in the adjuvant setting at least a year. And the more modern tyrosine kinase inhibitors now cause arthritis as well. So it's becoming an ever-increasing problem. So what are we doing about this extra information we've learned from the study? Well, first of all, is to change information sheets. So when you're counselling patients about which side effects they're likely to experience on taking hormone therapies, we can put it in the information sheet and it will be more accurate for them, which is very good, not only from organisations such as Cancer Relief Macmillan, which supply leaflets around the UK, but also website resources which are more and more commonly used now. So not only can we just inform people about the level of toxicity, we can actually design information leaflets to help them prevent getting the symptom. We know, for example, that if people exercise and stretch and avoid weight gain, they can reduce the level of arthritis. So this can be put into information sheets and given to them right at the beginning of their therapy. The other important issue if patients are suffering from arthritis is its interaction with exercise. Now, this is a study we performed a couple of years ago between Bedford and Cambridge, looking at the level of exercise after cancer treatment. Now, unfortunately, only 11% of patients were regarded as active, in other words, exercising up to 3 hours a week. The majority were inactive. We also more recently asked patients why they weren't being active, because we often reinforce to them the importance of exercise. Now, up to 30% said they weren't able to exercise because of their arthritis, and arthritis is becoming more common. So we specifically need to look in more detail at this interaction. So if arthritis is stopping people exercise, they're missing out on the benefits of exercise. We know from this meta-analysis published in the BMJ that people who exercise particularly in supervised programs after cancer have a significant reduction in fatigue, mood, and an improvement in overall quality of life. More importantly, we know from a meta-analysis we performed and others that if you exercise 2 to 4 hours a week, you have probably up to a 30% reduction in your risk of relapse, as well as improvements in other sort of rarer side effects such as peripheral neuropathy, hot flushes, and indeed weight gain. So if you're not exercising, you're risking worse side effects and a worse outcome. This was a very interesting study from New York, published last year, and quite ironically, the best thing you can do, what it shows is the best thing you can do for arthritis is actually exercise itself. This was a randomization of a small group of 120 patients who were put into an exercise program, and those who were able to exercise had a 30% reduction in joint stiffness and arthritis, and hence were able to exercise more. So we're in a chicken and egg situation here. Cancer treatments cause arthritis in over 50% of people. One of the barriers to exercise is arthritis, yet the best thing you can do for arthritis is to exercise. So what the next part of this study is to see whether we can actually do anything about reducing the incidence of arthritis and allowing people to exercise more. So the next part of our study was to look at the level of nutritional supplements patients take in this cohort. And what we found that overall, just over 50% of patients regularly take nutritional supplements, which is in keeping with the existing published data. But what hasn't previously been reported, that in the group who are suffering from symptoms, there was up to an 80% intake of nutritional supplements compared to 20% who didn't have any symptoms. So it's actually the symptoms that are triggering people to go out and try to help themselves, at least in that dimension of taking a supplement. And this slide really confirms that they're taking supplements for specific symptoms. As you can see, the level of evening primrose oil and starflower oil is up to 50%, and this is usually taken for hot flushes. But glucosamine, chondroitin and fish oils are often taken for arthritis, and again that's just over 40% of people are taking them for these reasons. And there's a sort of a spectrum of other supplements people take for a variety of other reasons. When you look at the actual data, the published data, to see whether any of these supplements actually have any evidence of effectiveness, most of them, I'm afraid, don't. This was data from a report issued by Arthritis Research UK, which looked at 13 randomised controlled trials of the benefits of glucosamine, 22 for chondroitin, and 17 for fish oils, and they all actually reported very doubtful benefits of taking them. So patients are going out and buying things over the counter, which is actually costing them money, which have got a very unlikely benefit to help their symptoms. So, apart from exercise, are there any supplements, for example, which people can take, which might improve their symptoms, which we don't have the data yet? Now, looking at the Arthritis Research UK report, they felt that polyphenol-rich foods had a very promising role to be looked at in more detail. These polyphenols are natural chemicals which we have in food, which give food the colour, the taste and the aroma, but they have many other health benefits which particularly can help joints. For example, we know that these foods have anti-inflammatory properties, so reduce some of the discomfort in the joint, but they also have antioxidant properties, so they will help mop up free radicals before they get into joints and damage cartilage cells. But they also have been shown in animal and cell line data to have direct anti-apoptotic benefits, so they prevent cartilage cells from killing themselves when exposed to trauma or an ingested toxin. And some of them actually directly modulate metalloproteins, which are the enzymes responsible for remodeling the joint, usually in a detrimental way and causing arthritis. So what we're leading on to is that people have a high level of arthritis, they're taking supplements which probably don't work, but there may be some benefits to looking at supplements such as polyphenol-rich supplements, which could benefit. So what we plan to do is to conduct a double-blind randomized controlled trial involving women with breast cancer taking hormones and men with prostate cancer taking hormones. We're going to randomize them to a supplement containing polyphenol-rich foods against placebo. And we're going to actually start that process right at the beginning of the hormone therapies in a way to try to get in there early to try and prevent arthritis developing, which usually happens at about 4 to 5 months. So it's a very good model to test whether these foods work. And at the same time, heavily counsel both groups to see to the benefits of exercise and refer them to local gyms and walking groups, etc. Now, after 6 months, we're going to then measure the level of exercise between each group and the level of arthritis. And we're going to start that later in the year in the UK. Now going back and looking at the men and whether men take over-the-counter nutritional supplements. Now, overall, there was a higher number took supplements, and this was 64%. And there wasn't a difference in this group between men taking hormones and men not taking hormones. Now, the reason for this is that in the study there was a fairly large group who were on active surveillance, so they weren't taking hormones, but they have looked at the data internationally and talked to each other in advocacy groups, and they understand that there is some evidence that a healthy lifestyle and selected supplements might reduce the rate of prostate cancer progression. So in this group, it wasn't determined whether there was toxicities or not, but really whether they were on active surveillance or not. So what were men in this study taking? Well, nearly 80% were taking the polyphenol-rich supplement POMI-T, but still a large group were taking the previously popular supplements such as saw palmetto, lycopene, selenium, zinc, or just multivitamins. We'll now look at the data to see whether there's any evidence these could be beneficial. The reason why POMI-T, a supplement known as POMI-T, is so popular in this group was fairly justified because this was evaluated in a double-blind randomized controlled trial, and it showed that men who took it regularly had a 64% reduction in the rate of PSA progression compared to placebo. This data was published in ASCO 2013 as an oral presentation and published in an established medical journal. A later study then looked at whether this PSA effect was linked to underlying tumour size seen on MRI, and there was a very high correlation between the two, which showed that the taking the supplement didn't just have a PSA effect, it had an underlying tumour effect. So at least this supplement has good evidence to back it up, so it's justified that patients want to go out and buy it to try and help themselves. The same can't be said, however, for some of the other popular supplements patients take in active surveillance. We know from the health professionals follow-up study, for example, that men who take zinc supplements over a long period of time actually increase their risk of prostate cancer. So this is not a supplement we'd recommend in this group unless they're known to have a zinc deficiency. The same applies to vitamin E and selenium. The SELECT study published last year showed that if you were on a combination of vitamin and insulin, you increased your risk of prostate cancer. So again, it's inappropriate that people are taking these supplements. Coming on to the other popular supplements such as saw palmetto, lycopene, ginseng from soya. There's no study to show they do any harm, and there's some very early small studies they showed a slight benefit. But when you look at the larger randomized studies conducted by the NCI, I'm afraid there was no evidence of any benefit, both in terms of the PSA or other parameters of well-being. So again, people are taking supplements which are costing them money without having any benefit. So in conclusion to this study we're presenting in Adelaide, this is a large cohort of patients in the real world, so we feel this is an accurate representation of the side effects they're suffering on a daily basis, and up to 70% report a troublesome side effect. Of that 70%, arthritis ranks significantly higher than previously thought of, with up to 50% of women and 40% of men experiencing arthritis. And we feel this information is important because we can adjust and edit information materials so patients are informed and empowered to know what to expect. It will help physicians in the follow-up period so they can give appropriate advice to patients, and we can give lifestyle advice specific to the likely symptoms they're experiencing, so in other words preventing them gaining weight and joining exercise classes and stretching. More importantly, we know that from this data that patients like to take over-the-counter supplements. More importantly, we know from this data that up to 70% of patients with symptoms will take over-the-counter nutritional supplements, most of which have very little evidence of benefit. But what it's highlights is the need for a randomized study looking at other supplements such as polyphenol-rich supplement, which might actually address their arthritis, and if their arthritis is addressed, they exercise more and their overall well-being improves. And thank you very much for listening. If you want any more information on our ongoing research program or the progress of the randomized study I was referring to, please feel free to log on to our website and any of the social media attached to it.